class. My name is Linda Obeng Adjei, and my presentation today is on the practice of Hijama as a traditional medicine among Siwa culture of Egypt. Below are my presentation outline: Introduction to the Siwa culture, History of Hijama, Hijama practice, Health effects of Hijama, Interventional program proposal, Solution to mitigate the problem, Promotion of proper sterilization, Budget for the interventional project, Proper evaluation, Conclusion, and references. Introducing the Siwa culture. The Siwans are an ethnic group located between Cairo and the Egyptian-Libyan border. They settled near the oasis due to their unique culture as herdsmen and neglect by the Egyptian majority. They are mostly farmers raising cattle, cultivating date palms, and mining salt. They consist of clans, which include extended families ruled by a chief. They are mostly Muslims, about 98%. To date, they have a strong belief in traditional medicines passed on to them by their ancestors. They believe in black magic and the evil eye, and their phenomena are said to be connected to Satan. Black magic among the Siwans associated with an evil spell cast on someone with the purpose to cause illness or divorce. Traditional medicine practice used to treat all forms of alignment is known as Hijama. One may ask, what then is Hijama? Hijama in Arabic is a traditional alternative medicine that has been practiced in different cultures. The earliest recorded references to Hijama practice are found in the Ebers Papyrus, written by ancient Egyptians in 1550 BC. It is noted that Hijama use in Egypt dates to 3500 BC. It is believed that Hijama therapy with a good safety profile has a checked history, and it is well recognized traditional method for managing medical conditions. Currently, the scope of Hijama therapy is expanding, and a growing body of research is providing additional evidence-based aids for the further advancement of cupping therapy in the treatment of a variety of diseases. Health effects of Hijama. Poorly managed incisions have the tendency of developing into severe infections. Unsterilized instruments can lead to tetanus and other infectious diseases. It can negatively impact women's health in terms of infection, bleeding, and toxicity. Permanent scars are left on the skin, painful and burning sensations, skin discoloration, anemia, and red blood cell deficiency. The health effects of hijama also includes cirrhosis of the liver, serious heart defects, HIV, hepatitis, syphilis, and so on. Interventional program proposal. Hijama is often performed in unsafe environments and poor hygienic conditions. Patients must be treated in a safer and more hygienic conditions in future. Possible relevant health consequences with these practices have raised ethical concerns. Health laws and policies must be used to evaluate the health consequences and ethical dilemmas. Program will focus on providing health education awareness, resorting to healthcare facilities and certified professionals among the Siwa tribe by the end of the year 2022. SMART objective. By the end of the year 2022, hijama practice among the Siwa culture will be reduced by 70%. Solutions to mitigate hijama. There must be an increased awareness and education among the increased community and then the healers about the risk with Hijama. Government intervention through the proper implementation of health policies to eradicate Hijama and increase access to a more reliable and scientific-based care. Sterilization of instruments is also the key to the infection control program. There must be an increased educational awareness on proper sterilization of Hijama instruments. Promoting proper sterilization. Sterilization of instruments and materials, sterilizer monitoring is an essential part of any infection control program. Education and awareness on proper Hijama instruments. Although Hijama continues to be a practice in the Siwa culture, education will be provided to improve the infection control, risk assessment, and disease management. Proper demonstration on reusable contaminated instruments and devices are received, sorted, and cleaned in the cleaning area. Budget to implement project. The budget below, sponsored by the Liberty Health Missions, describe the cost of raising awareness on the health impacts of Hijama. Program evaluation. An evaluation program is essential to help collect and analyze data to determine the success rate within the Siwa culture. It will highlight areas improvement or elimination to help the program meet its full potential. The proposal also discusses the available and required resources, the estimated budget, the evaluation methodology, and an explanation of the plan to maintain frequent communications through the program. Strategies and tools to evaluate the Hijama prevention program can include periodic observational assessment to document procedures and routine review of exposures to blood-borne pathogens. The preventive medicine program and policies can be used to evaluate the degree of infection prevention. Evaluation offers an opportunity to improve the effectiveness of both the infection prevention and Hijama procedures. In conclusion, Siwans believe strongly in Hijama as their ultimate source of healing for all diseases. Hijama is known to have negative health impacts and patient outcomes. Hijama is not a scientific-based approach of healing. Public health education and preventive medicine is of utmost importance. There is a need for increased access to quality medical care facilities, an increased importance of sterilization. Traditional healers must be taken through a series of training to certify them to perform Hijama procedure. More evidence-based research and interventional programs must be evaluated to ascertain the success and the shortfall of Hijama. Below are my references on the practice of Hijama as a traditional medicine among Siwa culture of Egypt. Thank you and have a great day.